was late to get braces in high school and had orthodontics into college. And during that, had orthodontic surgery over the summer during college to expand my upper palate. They removed bone from my jaw, and then the year after that, I had TMJ surgery because that surgery caused TMJ pain, and I have clicking in my right side of my jaw. I had an open bite that was repaired through orthodontic surgery, and then was within normal limits, but now I'm starting to have orthodontic relapse with more of an open bite on the front teeth. I've had a chronic history of TMJ since then, and wear a splint at night on my lower jaw to help with grinding at night. I do clench my teeth during the day and at night. I have chronic headaches, probably a level 7 or 8 every day, and then sometimes it'll peak up to a 10 or higher to a migraine if the barometric pressure is changing, or if I have a lot of head and neck tension. I chronically have tension in my shoulders and have lower back pain. My head is a forward position, and I'm a singer as well, so I've had to work with vocal coaches in the past to push my chin back to open my airway to get better breath support. I also was diagnosed with Chiari malformation, a mild form of it, when I was in college. That I don't have any known symptoms. They said it was pretty benign with that.
Can you explain what that is?
So my brainstem and my C-spine are very close in proximity to each other, so it can cause severe headaches and lower back pain, but at the time I wasn't having any of those symptoms. So they considered it just to be insignificant at that time. I do have really short back and side teeth from grinding over the years, which throws my bite off as well. I do have difficulty lateralizing my tongue without moving my jaw to the side to be able to clean food from the side of the mouth. I sometimes have to do a finger sweep to clean out cracker debris and things like that when I'm eating, things that fall apart in my mouth really easily. I do feel like when I am more fatigued that I lisp a little bit, which as a speech pathologist drives me crazy. I have had some cardiac just arrhythmias recently, which may or may not be related. And I constantly have tenderness and pain at my jaw joint here, in my forehead, sometimes here sinus-wise, and then under my jaw here. I was recommended to have sinus nasal surgery, but refused to do that. I didn't want to go through that. I've had, since I was 5, chronic ear eustachian tube issues, and have had about 10 ear surgeries for tubes and rebuilding my eardrum as well. And I do snore at night at times. I was told I had a deviated septum at one time, but I don't know that that's actually true. Trying to think what else I'm forgetting. I think those are most of the I do have a history of reflux as well. And it will peak sometimes higher than others. I'm not on medication for it. I usually just watch what I eat.